Toothache is one of the worst pains that anyone can experience, and Dr. Andrew Hagan is here to discuss the different types of toothaches and what you can do at home to help relieve the pain from that pain in your mouth. Dr. Andrew Hagan, thank you for being here.
Hey, good morning.
Today.
Thanks for having me.
It's good to see you again.
Thank you.
But this is something that's universal. I mean, I think everybody in their life has some kind of toothache pain at some point.
It's one of those unpleasant things a lot of us have to deal with. And it's one of those things we talk with our female patients sometimes, and they say they'd rather go through childbirth than experience a toothache.
That is a bold statement.
Exactly. So it's no fun, and we take it seriously and try to help our patients get through it as best they can.
Now, real quickly, what are some of the different types of, what are the conditions that lead to toothache?
Yeah, so there's a lot of different things that can cause toothache issues, clenching or grinding your teeth, actually sinus issues, migraines, and gum issues. But the most common one we see at our office is called pulpitis. Okay. And so that's kind of refers to the living tissue on the inside of a tooth is the pulp. That's where the blood and the nerve and the inside of the tooth is. So usually this happens, the pulpitis happens when a large cavity comes from the outside of the tooth to the middle of the tooth into the pulp, but it can also happen if you have an accident and break a tooth really badly. Essentially, a tooth is hard, obviously,
yes.
And so when you have inflammation on the inside of it, it can't swell like your skin. If you get a mosquito bite, it swells up or something like that. But so the pressure builds up on the inside of the tooth and around the tooth, and that's where you get that severe pain from. So,
and there are some things that you can do at home before you go to see the dentist, before they come to see you. There are a few things you can do.
Exactly. Well, we recommend people, unless they're dying in pain or if you have facial swelling, that obviously warrants an immediate call. Yes. But if you're kind of on the fence, like kind of moderate pain, you can do, over-the-counter pain relievers work really well for that, Tylenol or ibuprofen. But we caution people, don't put aspirin or like BC powder in the cheek or the lip by the tooth, because that can cause a chemical burn, believe it or not. So we've seen some bad situations where people have a toothache and then they have a chemical burn on top of that.
That is an old-time remedy for folks,
but that's usually not a good idea. So if you feel like you got to do something like that, Orajel works fine, a little bit of Orajel in the area. Ice packs over the tooth, or over the face outside the tooth that's hurting you helps a lot. And
you suggest ice instead of heat on it?
Ice, yeah, especially if it's starting to swell a little bit. Ice is going to help quite a bit to kind of help with the inflammation and help things from spreading. And
if things are really bad, they need to come see you.
They do, yeah. If things don't resolve after a day or two, or the pain is just the point that you can't sleep or you can't function, obviously you need to call a dentist. And at our office, we take that seriously. We know how bad that can be, so we do our best. It's a priority for us. We usually leave a few spots every day for people, whether they're our patients or whether they've never seen us before, to come in, and a lot of times we can get them in that very same day to get them out of pain.
You really want to get those folks in as quickly as possible.
Exactly, and that's a priority for us. Yeah.
Do you see this on do you see a lot of toothache every week? I mean, every day is someone presenting themselves and saying,
just about every day, yeah. And that's again, we pride ourselves on trying to take care of people. And even for our current patients, if you're a current patient of record, we give you an emergency number, because sometimes it's inconvenient. It doesn't always happen during business hours, so after hours or on the weekends, they can reach someone for office, and we can talk them through those ideas on how to get through it, or if it's,
I started to say, I think a lot of folks, when they have that really bad pain, they're automatically thinking they're going to have to extract that tooth. Yeah. That's probably the last measure, isn't it?
Yeah, exactly. There's a lot of options out there. For a tooth, someone that's having a lot of pain, we have a lot of options that we can do to save a tooth. Sometimes that is the only option, but of course, root canals and crowns and other things, depending on the situation that's going on. Well, technology's come a long way, and we can save teeth in a lot of situations.
All right, toothache. It's universal, folks, and Dr. Andrew Hagan has the means to take care of it, and some good tips for taking care of things at home, maybe a little bit. Yeah. Dr. Andrew Hagan,
thank you very much.
We've got some information for you right there at the bottom of the screen, and right there on the screen, Hagan Dentistry, right there on Clinic Drive, Suite A in Kingsport. Give them a call. There's the fax number as well, and their website. Check it out. If you've got toothache, that's the place to go right there. And